The ability to access and apply vetted, credible, and up-to-date clinical knowledge is essential to providing optimal patient care. This article describes the components of a knowledge management program and how they've evolved over time. I'm Jane Shellum, Emeritus staff at the Mayo Clinic and former IT section head for the Knowledge Management and Delivery Program. My colleague Rose Anderson and I worked with Dr. Rick Nishimura, Dr. Shonda Blackman, and Dr. Brad Leibovich to put together this article called Knowledge Management at an Academic Medical Center, Providing Clinical Knowledge at the Point of Care. The article will appear in the upcoming August edition of the Mayo Clinic Proceedings.
I'm Rose Anderson, Principal Product Manager at Mayo Clinic. The knowledge management program described in this article has been built from a consistent focus on the practical needs of the clinician at the point of care. How might they quickly find answers to their frequently asked questions? How might a digital solution help them tap into the collective expertise of their colleagues across specialties? The knowledge management program has also focused on the principle of preserving clinician judgment. How might digital systems be designed to enrich, not replace, the wisdom of the medical practitioner? How might the digital experience assist the clinician in incorporating the latest medical knowledge together with all relevant information from the record to meet the needs of the patient in front of them? Our article discusses what we have learned from striving to capture, manage, and deliver clinical knowledge in a way that reflects how physicians think and supports them in their clinical decision-making.
The knowledge management program includes the infrastructure, both technical and organizational, to support knowledge management as well as solutions for delivering knowledge. The technical infrastructure is based on a federated concept, meaning that knowledge artifacts of different types can be stored in different systems across the organization, so long as there's an overarching metadata model that's used to index that knowledge and a single search solution that provides access to the knowledge. The organizational infrastructure revolves around what we call knowledge content boards, which are groups of clinical and educational experts from every specialty. The knowledge content boards are charged with driving consensus and vetting clinical knowledge. The knowledge content boards are supported by a multidisciplinary group of editors, data scientists, software engineers, medical ontologists, and knowledge engineers. The knowledge delivery solutions include AskMayoExpert, an online knowledge resource that provides rapid answers to clinical questions of varying complexity. MayoExpert Decision Advisor is a knowledge delivery tool that provides context for clinical decision-making by bringing together pertinent patient data with patient-specific knowledge and guidance. The program also supports a broad range of other clinical systems, ensuring that they are current and consistent and represent the Mayo Clinic standard of practice. For example, the order sets, protocols, alerts, reminders, and clinical calculators in our electronic health record are based on core clinical content, as are the innovative clinical systems that augment our EHR. This program affects the practice in two ways. The most exciting one, I think, is our ability to leverage clinical expertise. We often get asked about the investment of clinician time in the program, and rightly so, it is an investment. But what we found is that we're able to leverage that investment, that colleagues across the practice are able to answer clinical questions more quickly and more confidently, resulting in time savings across the organization. Our clinicians have also articulated how much they value having a trusted resource, a one-stop shop for getting the answers they know that they would get if they asked their colleagues.
So how does this work impact patients? The processes and technologies described in this article enable the exchange of knowledge among medical practitioners. When the patient's physician can easily access the expertise of colleagues across the organization, that physician is better positioned to determine the best course of care. We've been asked to discuss what our next steps are for this research. And to answer this, I'll reflect back on the consistent focus of the knowledge management program at Mayo Clinic, the knowledge needs of the clinician at the point of care, and how we can continue to improve our ability to synthesize, capture, and deliver the relevant answers to clinical questions. Since the inception of this program, the knowledge elicitation processes have continued to be refined and the delivery technologies advanced. The next line of this refinement and experimentation is manifesting in the MayoExpert Decision Advisor application described in this article. Clinicians are dealing with continued advances in medical knowledge and a whirlwind of new data points, any of which maybe have the potential to be relevant to the individual patient that they're focused on. Therefore, the underlying system must have the capability to be highly adaptive and support complex, layered situational contexts. In this article, we discuss the next evolution of trying to meet that challenge with MayoExpert Decision Advisor. It uses a model-driven approach, which means that its underlying knowledge artifacts can be kept current and expanded without new additional software development. This has proven out foundational elements for a knowledge elicitation and management system that can be highly accessible for rapid subject matter expert to screen publishing, and yet support a delivery experience that is extremely adaptable and can instantiate views of the most relevant information at the right time based on the situational context. In the coming years, not just at Mayo Clinic, but broadly across healthcare, we'll see further experimentation with emerging technologies, various types of AI models, advances in the computational validation of those models, content systems that enable semantic structuring and on-the-fly contextualized delivery, and significant improvements in data centricity and interoperability in healthcare, all of which can be applied to further clinical knowledge management and delivery.
I hope that this has piqued your interest in the topic and that you'll take the opportunity to read through the description of the Knowledge Management Program at the Mayo Clinic.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.